And I'm going to be your nurse today. I need to do a head-to-toe assessment on you. Is that okay?
That's okay.
Okay, I'm just going to step away and wash my hands really quick. Go away, wash my hands, come back. Let me shut the door for privacy. And your name is?
Risa Chaplin.
And your date of birth is?
January 4th, 1986.
Let me check your ID badge, which indicates that. Do you know where you're at today?
This clinic,
And do you know what the date is?
August 24th, 2016.
And who is the president?
Barack Obama.
Okay, so you're alert and oriented times 3. Your speech is nice and clear, your hygiene's good, your posture is great, and you're dressed appropriately for where you're at this time. I'm just going to examine your head now, feeling for masses, lesions, scars, any bumps. You let me know if anything hurts. And her scalp is nice and clean, her hair is clean, she doesn't have any parasites at this time, okay? All right, and looking at me, I want you to close your eyes really tightly. Open them, close, squint. All right, and make your eyebrows go up and down. And can you smile? Okay, good. Now I'm going to touch the sides of your face and I want you to shut your eyes and tell me which side I'm touching, okay?
Left, top, right, bottom.
Okay, and you can open your eyes now. So just checking your cranial nerves, your facial nerves, and touch, just making sure that all works. And I don't see any deficiency. It's nice and symmetric, okay? Now I'm going to look at your eyes. I don't see any redness, any drainage. Her sclera is nice and white. I'm going to check your eyes now. My light. All right, and just look straight ahead at me. Okay, so our pupils are nice and equal and round and reactive to light. So just follow my finger without moving your head, okay? And they also perform to accommodation. She has no extra movements there. So it's checking her optic nerve as well as cranial nerves 2, 3, 4, and 6. Okay, so now I'm just going to look at your nose really quick, okay? Can you lean your head back just a little bit? And I'm checking. She does not have a deviated septum. Her nares are nice. And I don't see any lesions, masses, or any type of mucus, crustation, anything like that. I'm just going to touch right here. Breathe, sniff. And on the opposite side. Okay, good. All right. And can you open your mouth for me? Say ah. Okay, so her uvula is visible and her mucous membranes are nice and pink and moist. She has her tonsils and adenoids and I don't see any lesions. Her teeth are very healthy, okay? Also now I need to just perform one additional test if you could step off for me that I forgot about with your eyes. Okay. All right, this is commentation test. I'm checking your peripheral vision. Okay, so cover the same eye as me. All right, and when you see my finger wiggle, I want you to tell me.
See it, 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 see it.
And the opposite. And just when you see it wiggle.
See it, see it, see it, see it, see it.
Okay, good. All right, go ahead and have a seat for me. Now I'm going to check your ears. All right, and let's start with this one. And I'm looking for any obstructions. Making sure that her tympanic membrane is nice and shiny and pearlesque. No excess serum. And checking the opposite ear for the same thing. And noting that they are in line with her eyes and appropriate. And this ear also is clear of serum and her tympanic membrane is easily seen. I'm going to perform a test now. I want you to shut your eyes. And when I put my hands beside your ears, just tell me which side you hear the sound coming from. Okay, I'm checking your cranial nerve 8.
Left, right,
Okay.
left.
Okay, that's good. All right. So now I'm just going to fill on your throat and checking your lymph nodes, okay? So starting here at the front with submental, submandibular, intra-auricular, post-auricular, on your tonsils, occipital, posterior cervical, anterior cervical, and supraclavicular. Feeling for any masses? Anything there hurt?
No.
Okay, I didn't notice anything. All right, so now I am just going to listen to your lungs really quickly, okay? So starting on the right side, upper anterior lobe. And take a deep breath in and out through your mouth. And then again. On the left side. And then again. And then again. And then again. And again. And coming to the opposite. Again. Again. Okay. And just making sure that her respirations are even and labored. I don't see any use of accessory muscles. I don't hear any wheezing, any rales in her bronchi. Deep breath in. On this side. And then in the back, posterior, left upper lobe. And going back and forth to compare both sides. And our lungs are clear to auscultation on all lobes. Okay, and while I'm back here, just gonna ask you to lean forward. And I'm looking at her spine and palpating it, checking, make sure that it's nice on the line, there's no curvature or deformities. Okay, and while I'm back here, can you turn a little bit towards me? And I'm just checking her thoracic expansion. Take a deep breath in and let it out. And then again, let it out. Okay. Also, while I'm back here, I'm going to just tap back here, and you let me know if you feel any pain back here, okay?
Okay.
All right.
No pain.
Okay, and just checking both sides of her kidneys. All right, great. And just sit forward for me again. Okay, good. And noted that she has a 1 to 2 anterior posterior transverse section of the lungs, which is nice and appropriate as it should be. Okay, so while I have you here, I'm just going to look at your skin, which is nice and warm and dry and intact. I don't see any lesions, deformities, or anything like that. Her capillary refill in her fingers is very rapid, less than 3 seconds. Coming down, I don't see any edema. Coming down, her legs are the same. No deformities, no edema. Can you stand up for me? Okay, and while you're there, I'm just going to check your gait. And what I'd like for you to do is, if you can, come towards me. Just walk normal, and then towards the wall, and do one foot in front of the other, heel to toe. All right, and come back towards me again, and close your eyes. And I'm just going to check your Romberg test. Once again, cranial nerve 8 for balance. And she's great. Okay, go ahead and open your eyes back. If you could sit back down for me. Okay, and we're just going to lay this back while I check your abdomen. I'm sorry, I need to listen to your heart. And I'm starting at the aortic area, which is the right side, second intercostal space. And now I'm moving to the pulmonic area, which is left side, second intercostal space. I hear the S1, S2 clearly. Then I'm moving to the Erbs space, third intercostal space, left side. Tricuspid, fourth space, intercostal, left side. Then mitral, fifth intercostal space, left side. And I don't hear any murmurs, any gallops, any extra beats. Her rhythm is nice and equal. I just need to fill her carotid arteries really quick. One at a time. And they're both nice and strong +2. I don't feel any bruise at all. Okay, great. All right, now if I could get you to lay back so I can listen to your belly. Take a look at it. So lay flat. Okay, so at her appearance, she's nice and flat, slightly rounded, which is appropriate for her size. I'm just gonna take a look first. I don't see any masses, any deformity whatsoever. Just gonna take a listen, okay? Starting in the right upper quadrant. Listening for vowel sounds. Left upper quadrant. Do you have bowel movements every day?
Yes.
Do you have any problems with urination?
No.
In her left lower quadrant? Right lower quadrant? When was your last menstrual period?
A month ago.
So bowel sounds are within normal limits. She's having between 5 to 10 for a 15-second interval. Okay. And just gonna feel real quick. You let me know if anything hurts. I'm checking for masses. Any rebound tenderness? Any hard spots? Okay, everything looks nice and normal. Go ahead and sit up for me. All right, and while I have you here, I'm just gonna check your range of motion real quick. Okay, so can you shrug your shoulders for me and push up against me? Okay, and then push against my hand. That's it. Once again, checking cranial nerves for strength. All right, and grab both my hands real tight. Okay, and I am going to, all right, now just push against me. Okay, and then pull your hands like this. Okay, and push again. Okay, put your arms out. Okay, and can you do this? And move them all the way around. Okay, and can you move your legs? Up, down. Okay, and do me a favor, push against me. Okay. Now the opposite, push down against me. Again. And up. Okay, come here and push on the gas. Okay, and then push against my foot. There we go. I mean against my hand. Again, push. Then up again. Okay, great. All right, so range of motion is nice. Your strength is nice and balanced in both hands. Okay, so while I'm here, I'm just gonna feel your pulses. Okay, and check. Let's move this back a little bit. And check it on both sides at the same time just to make sure that they're equal. And starting here first at the radius. And they're +2, 3 actually, and equal. And moving up to the, just relax your hands, to a brachial. Okay, and then coming down and popliteal, which is hard to feel. Just relax your legs. And coming and feeling. And then pedal. And they're nice and equal, not bounding, not thready. They feel nice. I don't see any issues there. So now I'm just gonna check your reflexes really quick, okay? All right, so I'm gonna start with her right side first and try up here with her. Okay, just relax. Okay, there we go. Okay, good. I'm moving to brachial. Good. Brachial radial. Okay. We're moving to the opposite side. Triceps again. That was a good one. Don't break your arm again. Good. Then come down here. Patella. Alright, just pull up a little bit. Thank you. Relax. Ooh, that was a good one. Okay. Come back here. Just put your foot flat for me. Okay, so nice reflexes. No clonus, no excessive movement. All right, well, thank you very much. I'm just gonna go wash my hands and thank you for allowing me to do this.
Thank you.